Good evening, good evening, good evening, everyone. Come on in and join me. Welcome in this rainy Sunday, cold Sunday. I hope everyone has had a blessed and a beautiful day today, despite the rain. I hope there was sunshine within, and so I'm praying that everyone just had an awesome day today. Hello, Duchess. How are you? I would like to ask you guys to do me a favor when you come in and just like this video and share it. I'm huffing and puffing because I was wrestling with my camera, trying to get it in. I got this new ring light and I was trying to get it in the little stand and it was fighting me back. So we were wrestling, but I won. I did win. So welcome in to Juju's Dollhouse. Welcome to Let's Talk. And we're going to go ahead and we're going to get started. It is 7 o'clock p.m. I want to thank you all for joining us. And like I said, those that are here, if you would please do me a big favor, like and share the video. Tell me hello, put a comment out there so I'll know that you're in the dollhouse with me, joining me in tonight's discussion. Welcome to this week's edition of Let's Talk. I am your host, Juju, and we are coming to you live from the house that Juju built. This is Juju's Dollhouse. My motto is, I am walking by faith, and I am inspiring hope and showing love all along the way. Each week here on Let's Talk, we will discuss current events and their impact on the Black community. We will also highlight local Black businesses, local entrepreneurs, local artisans, and upcoming events which will give small businesses an opportunity to showcase their products. Let's Talk is created to be a positive, uplifting, and informative discussion. All constructive opinions are welcome, as we must learn to listen to and consider the opinions of others, even if we don't agree with them. This, however, is not the place to tear down anyone. We come to uplift and enlighten. Therefore, if your comments are not coming from a place of love and not intended to be uplifting, we kindly ask that you please find another forum to express them. Please note that any opinions that I share are just that, my opinions. This is not intended to be a news show, but we will try our best to steer clear from gossip and things that are knowingly untrue. I hope each of you find this to be a safe place where you feel comfortable expressing yourself. Each week, we will also feature a local small business and give them an opportunity to tell us about their business and to showcase their products during the broadcast. I am a state employee. As a result, there may be some topics that I have to steer clear of. All of that being said, let's talk. Hello to everyone. Tonight's discussion is heart health, and I am very excited about this discussion tonight. As we all know, this is Heart Health Month, and Friday was Go Red for Heart Health with Women. So I am so excited to discuss heart health. And we're going to have some special guests with us tonight that's going to help us. We're going to have one health professional, and then also we will have someone who has dealt with or who is dealing with some heart issues. But anyway, just to give you a few statistics before we bring in our health professional. Hello, Denise Johnson. I'm so glad you joined me. You woke up in time to join us tonight. Thank you. And thank you to everyone who is with us tonight. Like I said, if you don't mind, please like and share this video. Hey, Starlet, that's my baby Bob. Thank you for joining. Anyway, some statistics that we have. According to the Center for Disease Control and Prevention, the CDC, heart disease is the leading cause of death in the United States. And it says that African Americans are 30% more likely to die from heart disease than are whites. And it says that also 1 in 3 women will die from heart disease, which is more than from all of the forms of cancer combined. And so that being said, you guys, I'm going to, hey, LaDeja, how you doing, boo? I'm going to bring in Miss Gwendolyn Johnson Butler. Y'all know I don't work this thing that well, but anyway, we're going to bring her in and we're going to talk about heart health. Um, and so it's adding Miss Gwen. Hey, darling, how you doing?
Hi, how are you?
I'm doing well. Welcome to the dollhouse. Thank
Hi, it's good to
you.
be here.
Yes, thank you for agreeing to join us tonight. You guys know Gwen. I'm sure you all know her. Y'all know her as the singing Gwen because the girl can show enough sing.
Thank you.
And then you all know her as the crocheting Gwen. She is the owner of Sugar Baby Crochet, and
That's
she
correct.
knows she can crochet.
Thank
But I don't know how many of you know that she is a medical professional. And that's the Gwen that we're going to deal with tonight. Although she's going to show us some things and talk a little bit about Sugar Baby Crochet a little later on. But anyway, thank you, Gwen, for joining us. So tell us a little about yourself, Gwen, as far as being a medical professional, because I want the people to know I'm not trying to tell them that about
you.
hard hair because I don't know. I'm gonna bring in a professional.
Well, you did very well. You did very well with the statistics that you gave because they are true. And my name is Gwendolyn Johnson Butler. I have been in the healthcare field for 30 plus years. I was an LPN for 13 years. I went to Opelika Tech, which is non existent, right out of high school, and was an LPN for 13 years and went back and uh, received my associate's degree from Chattahoochee Valley, CVCC, my RN licensure in 2003. I've worked at East Alabama Medical Center 25 plus years. I've also worked in 2 different physician offices. I've worked a little bit with home health, also a very short stint in a nursing home facility. I've done hospice, PRN. Uh, it's just nursing is one of those areas where you can bounce around and get experience throughout your career. So, but the majority of my time has been at East Alabama Health. I stand corrected, East Alabama Health. And currently, and for the past 17 years, I've worked in application support there at East Alabama Health, which my that department, we're responsible for documentation throughout the hospital. It just goes from security, from documentation and on. You would be surprised. Our hands are in a lot of different areas. It's similar to nursing informatics. So that's what I've been doing for the past 17 years. Other
Okay.
than that, my time has been at the bedside or in a physician office.
All righty. Well, now that we know that she's qualified, so now we're gonna get some information from her because um the statistic that said that Black women uh more die from heart disease
Hmm.
each year all of the cancers
Mm-hmm.
combined. When
Mm-hmm.
I read that, that really shocked me. I was surprised because it seems like to me we focus a lot on the different cancers
Mm-hmm.
and not as much on heart disease and heart health. And so knowing that heart disease and heart health hits our Black women and men so hard. That is something that we need, I think, to focus more on, spend more time on. And so that is why I decided, since, February is Heart Health Month,
Mm-hmm.
I decided that we would talk about some of these things
Mm-hmm.
tonight. Okay, so first of all, what exactly is heart disease? What is heart disease?
Heart disease, and this it's so the easiest way to say it, heart disease encompasses several different things. It's not one thing only or
Mhm.
one particular thing. That involves heart disease includes, okay, um, it includes your blood vessel disease. This is where you can have your heart vessels can be what we say stenosed, or they're closed in, and that's due to deposits of cholesterol or what we call
Okay.
plaque. The same plaque that builds up on your teeth, y'all, is
Okay.
what can build up in your arteries in your heart, okay, or your blood vessels, period. It can build up in your carotid arteries. Anything that's an opening, plaque can get there, okay? So it encompasses blood vessels disease. It includes irregular heartbeats. It includes heart problems that you're born with. Those are the congenital diseases, heart diseases. It can include diseases of the heart muscle. It also includes your cholesterol and your heart valve disease. Okay, that means you have problems with the valves inside of the heart. There's four valves, and those valves can have issues. Okay, and those issues can be whether they're stenosed, they're small or narrowed. It can also mean that those valves are leaky. Okay, they leak from the valve, or you can have um, where those valves are prolapsed and they don't close properly. Okay, so it encompasses all of those things. That's what heart disease means. And then you
Well,
have your issues
thank you.
between each
And,
one of them.
and so it's just it's a lot of different problems that you can have, not just a heart attack or not just congestive heart failure, which is what we think about most of the
Right.
time. You can have a
Exactly.
lot of other issues. Okay,
Exactly.
okay. What are the some of the symptoms that an individual may suffer from if they're dealing with heart disease? How can we
Depending
identify?
and so depending on the different areas that you may have issues with, but some of the common symptoms that are seen, you can have chest pain or chest discomfort. Some people don't call it chest pain. Oh, I just feel like I have gas.
Mm-hmm,
Or I
mm-hmm,
have a little tightness. They may not say
mm-hmm,
chest pain. And then you have those who absolutely have chest pain. They say, oh, it feels like a truck sitting on my chest or anything like that. You can have shortness of breath, and that shortness of breath can be with exertion. That means with activity, moving around, exercising, mopping, sweeping the floor, dancing, or it can be without exertion, meaning at rest. You can be doing nothing.
mm-hmm.
You're absolutely at rest and you're still short of breath. They also may have dizziness, lightheadedness, um, or fainting
Mhm,
spells. Okay,
mhm,
so that can be a part of it as well. So and then you have some people that have the numbness or tingling in their arms or their feet, and all of this is caused from that stenosis or the narrowing of those arteries and blood vessels, preventing blood from flowing to those areas.
circulation. Okay,
Okay, so
okay,
it can encompass a lot. Here's the thing: the best thing to do if you're having chest pain, chest discomfort, you're having gas a little bit too often, okay? Lightheadedness, any of those things, you need to, if you're actively having chest pain, call 911. Call
okay, Okay.
911. Don't
Okay.
try to don't try to drive yourself.
Okay.
Call 911, 911. Pick up the phone and
Okay.
call it. Now, if you're having this on an episodic type of frequency, you need to get in and see your primary care physician. And if you don't have a primary care physician, y'all, urgent care is not meant to be your one stop shop.
Thank you.
That's not what
Thank
it's
you.
meant to be. You need to have a primary care physician. Most of us have a beautician. We have someone that
Okay.
we go to and do our hair. You need to go and see somebody to check on you to make sure everything's okay. Someone that you can go and talk to, build a relationship with and a rapport with so that you can have things checked, blood work and other testing that can be done so that you know what's going on with your body. Okay.
Okay. Okay. Thank you. And Gwen, thank you for telling us that urgent care is not the
It's
primary
not.
care
It's not.
physician.
That's not your primary care physician.
Thank you
It's urgent care.
for telling us
The
that. That's why I tell people
emergency
that all the
room,
time.
and let
Hmm.
me add this, the emergency room is not your primary care physician. That's for emergencies.
Okay.
Okay. Not saying don't go, but y'all, that's not your primary care physician. Okay. You need a primary care physician. This
Thank
is the
you.
physician that primarily takes care of you.
Yes, ma'am. Thank you for that information. And Gwen, what are some of the risk factors that contribute to heart
Well,
disease?
here we go. A lot of people don't talk about this, and I'm glad that you brought this up. Biggest risk factors, y'all: diabetes.
Mm,
Diabetes is a factor. Hypertension, that's high blood pressure. Okay. Diabetes, you got my blood sugars up. All right.
mm,
I'm trying
mhm,
to say this in a way that people would grasp it. This is not to talk down, but it's to break it down, to make it
mhm.
plain and simple.
Okay.
Sugar, okay? Diabetes is a
Sure.
risk factor.
Mhm.
Hypertension, high blood pressure is a risk factor. Obesity, and I say that with loose lips because I am what they consider obese. Hey, well, we're gonna have to call the kettle black when we start talking about it. And if you look at the ranges, if they say about your weight,
Mhm.
and all of that, what you should weigh, a lot of us are obese and don't even know it. Or those people that have metabolic syndrome. You're not diabetic yet, but someone has told you, hey, they've checked the hemoglobin A1C, which is a test that allows you to know what your blood sugar's been doing over a 3 month period. And we're
Mhm.
going to talk about that some more. And they say, well, your hemoglobin A1C is 5.6. You creeping up there. You
Mhm.
need to
Mhm.
watch your sugar intake. You need to watch this. You have metabolic syndrome. That's what you have. And if you don't watch it, after a while, you'll develop diabetes type 2.
Okay.
And we're so
Okay.
quick. We are so quick. I'm talking about the black community. We're so quick to talk about what we don't have. I don't have that in the name of Jesus. In the name of Jesus, you do have it. But in the name of Jesus, you can be healed. You can do what you need to do in order to get better. Okay? The doctors,
Okay.
listen, it's tried, true, and proven. You have it. Now, what are you gonna do about it?
All
Okay?
right.
I'm just
Okay.
gonna keep it real.
Okay.
I'm
Thank you,
not here to
ma'am.
sugar. I'm not here to sugarcoat anything with you. When I found out that I had type 2 diabetes, I could have said no, I don't, and go on and just do what I want to do. And I don't do right all the time, but I
Mhm.
do mind my business. I take my medication. I pray to God. God help me. And when I make a bad decision, I say, Gwen, you got to do better. You hear
Okay.
me? And I
Okay.
go and I see my primary care physician every time he tell me to come and see him. I'm
Okay.
there. Okay.
Okay. All right. Well, thank you, Gwen, and just in full disclosure, I think I probably got all them those risk factors.
And all
So,
you need, how well, and not to ask you your age, you're younger than I am. So let me just say this: if you don't go and at least see your primary care physician once a year,
mhm,
at least see them. And with most state employees, you have to have a yearly check of your blood
wellness.
work, right? You
Mhm.
you do,
Right.
right?
You have to have a
And
wellness
and you
plan.
have to
Mm-hmm.
have your wellness exam, right? And in
Yes.
that wellness exam, they're gonna check your urine, they're gonna check your blood, and that blood is gonna include a lipid profile, a complete blood count, that's your CBC, and anything else that the physician chooses that's necessary in order to make sure you're in good condition. All right.
Okay.
And for women, depending on your age, they're gonna say, hey, you need to go have your mammogram done. When was the last time you went to the dentist? Y'all don't believe this, but when you don't go to the dentist, poor dental habits can lead to diabetes and heart disease. Having a
I did not know
having a
that.
having poor dental hygiene can lead to heart disease and diabetes. Let me tell you something. Baby, let's not even get started. Go to the
Well,
dentist.
I'm glad, because we need this information. This is the stuff that we
Go
need. That's why I
to the
wanted
dentist.
a medical professional, and I know I got the right one.
Don't
And
just don't just go out and get these veneers put on your teeth so you can have a bright white smile and your gums are rotten to the core. Huh?
oh, okay. Well, okay. Well, that being said, I have heard of, and I don't want, some things are true, some things are myths. So that's why you're here. People having infections like mouth infections that can go to the heart and cause heart
It
disease.
can. It can. Periodontal disease, gum disease can lead to big issues with your heart. It can lead to, infection. You can get septic from a bad tooth.
Hmm. Hmm.
You can get encephalitis from an infection from your tooth.
Hmm.
Think about it. Your mouth, your teeth, right there up in your skull is your brain, and the blood
Okay.
brain barrier is there. So we have to make sure that we go, and most dental plans allow you to go 3, sometimes 4 or more times per year to get your cleanings. Go to the dentist.
Uh,
Go to the dentist.
thank
Okay?
thank you so much for that information. Gwen, we're gonna have to have you back again
And
because
I'll
you
come
got so
back.
much information.
And I'll come
But
back.
okay, and we are we I want to ask you genetics, because I have a family
Mm-hmm.
history
Mm-hmm.
of heart disease.
Mm-hmm.
My mom died of heart
Mm-hmm.
disease. Her brother died of heart disease. Her mother died of heart
Mm-hmm.
disease. My grandfather died of heart disease.
Mm-hmm.
My brother has heart disease. And like I said, I have high blood pressure and I have
Mm-hmm.
diabetes.
Okay.
And so I want to know, how much does genetics have to
A
do
lot.
with heart disease?
A lot. An absolute lot. You need to know your family history, okay? So when you go to the doctor and they ask you about your mother and your father, they're not asking you stuff to tick you off and to waste time. They're asking so that they can make decisions about your care, okay? So it's important for us to have these talks. Sit down at the family dinner. This is why we got to get back to all of that. Sit
Mm-hmm.
down at the family reunions, okay? I ain't gonna say what I just thought. At the family reunions, you need to take a good look around and say how many people coming in here in wheelchairs, how many people got diabetic footwear on, how many people, huh? How many people's ankles are swollen, how many
Okay.
people have their the dialysis shunts in their arm,
Mm-hmm.
and you can go by and you can see what your family history is. And I'm not being funny, I'm just being real. Okay? Find
Mm-hmm.
out your family history. If they say to you in a hospital setting, maternal, that means your mother's side. If they
Mm-hmm.
say paternal, that means your father's side. Okay?
Mm-hmm.
Sometimes nursing personnel, we tend to speak at a high level and we don't speak at the level to where people can just everyday people can understand. That don't mean you're
Mm-hmm.
dumb. It
Right.
doesn't mean, it just means we need to break it down and speak at a level to where people can understand what it is that we're asking. Your family history matters. You need to know if anyone in your family has high blood pressure, heart disease, if they've had a stroke,
Mm-hmm.
any cancers, arthritis, any of that you need to know. Okay, you
Mhm.
need to know if your mama or daddy had open heart surgery, and
Mhm.
if they did, how many arteries were bypassed. They need to know that, and that's information for you to know. Write it down somewhere.
Okay.
Keep track of that, and so when you go to your primary care physician,
Mhm.
you have that information with you, and they can make the best plan of care for you and how to take care of you and to keep you out of the hospital, keep you keep your heart disease risk more lower. Okay.
Okay. And speaking about going to the primary care physician, and I know, like you said, they'll say, "Have you had your colonoscopy? Have you
Mm-hmm.
had your mammogram? Have you had this, that?" Is there a heart test or stress? I know they talk about stress
Mm-hmm.
test and echocardiograms and all of that. Is there a heart test that we need to be getting? And if so, when?
Okay.
What age?
So one of the things that at any age, okay, especially now, you have kids that are more sedentary, okay? So you actually need to be taking your kids to see their pediatrician. You need to be taking them to see them, not just when you think they have strep, flu, or COVID. You need to take your kids to the doctor, okay? I know of people that were diagnosed at in high school with hypertension, and the only
Mhm.
reason why they were diagnosed is because their mama was in nursing school and checked their blood
Okay.
pressure.
Okay.
Okay. So hypertension can affect anyone, even your children. Okay.
Mhm.
So we
Mhm.
need to make sure our kids, okay, if we mind the business that pay us, baby, we'll be better. We'll get
Mhm.
better. Here's the
Okay.
thing with diabetes and hypertension, all of this can lead to heart disease, kidney disease.
Mhm.
Okay. And
Mhm.
they say that African Americans are at a higher risk of those things: hypertension, diabetes, kidney disease, stroke.
Mhm.
Okay.
Mhm.
Those are the things
Mhm.
that we're at a disproportionate larger rate of having than other people. All right.
Okay.
And so
Okay.
this lends to the fact that we really do need to be proactive and not just reactive. All right.
Okay. So is there a test I need to tell my doctor I
Well,
want him to
Well,
perform?
he's going to do, if he's worth his weight in gold, he's going to do a lipid profile.
Mhm.
That's one of the things that he's going to do, and or chemistry profile, which will allow him to see what your total cholesterol level is, and
Mhm.
out of that, they're able to extract the good portion of cholesterol, which is your
Mhm.
LDL, which is your low density cholesterol. That's the bad cholesterol, y'all. That's
Okay.
bad. Low is bad. Your high density or your HDL is the
Okay.
good cholesterol. That's the portion of your cholesterol that's good. He's going to be able to tell you what your numbers are. And before we started, I went to the doctor last Tuesday. Well, no, last Wednesday. Had my appointment with my doctor. Okay. So, and I'm going to share with y'all because I'm not scared. Okay. My LDL or my low density is 52. Remember? And I told y'all that that's the bad.
Okay.
Well, it's good if it's less than
That,
100. Okay. The
that's great.
LDL is good if it's less than 100. So mine, as big as I am, is only 52. Okay.
Awesome.
The HDL, um, hold on. My HDL is also 52. All
Mhm.
right. But it's good if it's 40 or higher.
Okay.
So
Okay.
I'm
Okay.
I'm
You
not on the
great.
low side of it. I'm on the higher side of it. My total cholesterol is 125. It's good if it's less than
Listen.
200. If it's
Yes.
200 or up, they're going to start looking at your borderline if it's 200 to 240. If it's over 240, you got to be put on some type of cholesterol medication or statin in order to bring that cholesterol down, to try to bring down that risk factor of you having what we call atherosclerosis. That means having that cholesterol that's inside of your blood vessels and it coats it. And at first it's like butter
Mm.
on your teeth. Let's go back to the teeth. And then it hardens and gets like plaque.
Right. Okay.
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 So
Okay.
that, and I'm just sharing mine with you all. And he gives me a printout. And I put that
Okay.
doggone thing, I take a picture of it, I keep it in my note section on my phone so that I know what's going on. And because I have high blood pressure, diabetes, type 2, okay, I go and see my physician, my primary care physician, every 4 months.
Mm-hmm.
Okay. It's
Mm-hmm.
not once, he doesn't let me go once a year because some of
Right.
y'all, some of us don't know how to
Yeah.
act. So he
Yeah.
brings me
I,
in every
I
four
I'm on the
months.
4 month regiment with you,
But
Gwen.
you know
Yes.
what's going on with your body.
Yes.
Hmm.
Yes. Okay. And so let me ask you this. We talked about all these risk factors and how we are as Black people at a greater risk
Hmm.
because we are more apt to have these diabetes, high blood pressure. And a lot of it, why do we have it? I think some of it are eating
It
habits,
is. It
and then
is.
some of it is stress
Stress.
levels. We are
We walk
more.
around with, we wake up with stress. And
Mhm.
don't get me started. It's my belief. This is my theory, my belief that most African Americans have PTSD.
Mhm.
Most of us walk around in stress, okay,
Okay.
just because of things that are going on in the world, just because of just life in general.
Mhm.
That doesn't mean that you down and out. It doesn't mean that you're struggling. It just means there are some things that stress us. There's some, if you have children, whether they're young or whether they're grown, as a parent you stress, I want them to be okay. You don't want them to be involved in anything, okay? You hear
Mm.
and you watch the news and we see those things. Those things can stress you out. So
Yes.
stress, genetics, our eating habits, if we're not as active as we should be,
Okay.
all of that
Mhm.
plays a part in it.
Okay. And so, what can we do? Tell us what we can do to decrease our chances of being diagnosed with heart disease.
You can first of all go, if you don't have a primary care physician, get a primary care physician. Tell him what your thinking is and why you're there to see them. You want to establish yourself and get established with one. Talk about your family history. They're going to take your blood pressure. They're going to check your weight. He's going to do some baseline blood work, and he may either have those results for you that day or they'll call you back, and they may even say, come back and let me talk to you, let's have a follow-up, and
Mm.
go from there. And if your cholesterol's high, you need to be on a low cholesterol diet. He may start off with, let's see what changing your diet can do
Mhm.
before we put you on medication. I would
Mhm.
be, unless things are way out of whack, I would be nervous about a physician that wants to put you on medication out of the gate.
Right.
Okay. See what
Right.
you can do with diet and exercise first, and then go from there. And keep your appointments with your primary care physician. And most insurance plans are asking that you have the wellness check once a
Right.
year. Okay, something's going to be caught. We hope and we pray. But do you know most people don't realize they have heart disease until a heart attack
Mm.
or something happens
Mm.
to where they're in the hospital and now it's being told, hey, you have heart disease.
So when and this was one of the questions I gave you. So I'm just gonna always ask it off the cuff. But you so informative. I know you know what is when somebody said they have a heart attack. What is that?
Heart attack means that you've had an event that has happened where your heart is not getting the proper blood flow that you need, and
Okay.
that's either because you have a buildup of
Oh,
plaque,
okay.
which is that atherosclerosis, and it's limiting the blood flow. The meaning, think about a garden
Mm.
hose. It's open,
Mm.
blood is flowing through there freely, and as you get stenosis, it closes off. So now
Mm.
blood is not getting there. Your heart is a muscle. It needs the oxygen that's in your blood in order to live. And what happens is starts spasming. That's what causes the chest pain. and that heart muscle can die.
Okay.
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 And
Okay.
here's the thing, high blood pressure can lead to, remember we talked about disease of the heart muscle, meaning it can cause your heart to be too big and
Mm-hmm.
baggy and boggy.
Okay.
Having a big heart is not a good thing. Big
Okay.
heart physically is cardiomyopathy, and your heart won't squeeze as tight as it should in order to get the blood through your heart and out to your body and out to your major and vital organs. Okay, so that's
Okay.
what a heart attack is. And then your heart can stop. You can have irregular rhythms in your heart can stop, you can die, you may not die, you know, and then you have to be placed on medications to kind of help your heart get back to where it needs to be, lower that blood pressure, and relieve some of that stress on the heart.
Okay. So in summary, first of all, we need to get us a primary care physician.
Absolutely. Absolutely.
We need to know our numbers,
We need to
where
know
we
your numbers.
stand as
Yes,
far as blood pressure, cholesterol, A1C, hemoglobin A1C.
that's
We need
correct.
to know our numbers.
Yes,
Then we need to exercise.
that's
We
right.
need to eat better
Yes,
and de-stress.
that's it. That's it.
Okay.
And I personally will tell you all, I've been working very hard here lately because of the hypertension, diabetes types 2. And unfortunately, and I will say this, and it's not an excuse, sometimes until you're told, hey, this is what's going on, do you realize I need to try to do
Mhm,
right? You know what I'm saying? I don't do right, but
mhm,
I've been doing better. Lost
mhm,
weight, hemoglobin A1C is down, and I bought some equipment to start doing what I need to do here at home. I work from
mhm.
home,
Okay.
so being sedentary is
Mhm.
a large part of my day.
So
So I have to, you
make
know, figure
yourself.
out ways to be more
Mhm,
active.
mhm.
Exactly.
Okay. Well, thank you so much,
You're
Miss
welcome.
Gwen, for
Thank
that
you for having me.
information. It was just what we need. And like I said, I'm gonna have to have you back because we're
Okay,
gonna have to discuss some other things
we
as far
will.
as health is
Okay,
concerned, because that is it before we can do anything, we gotta be healthy, right? If
that's
we're
true.
not healthy, we
Healthier,
can't
healthier,
healthier
at least healthier.
and
Yes.
these healthier.
Hmm.
So thank you so much.
You're
And then
welcome.
also, while I have Miss Gwen here, me and Miss Gwen actually met met doing a praise-a-thon that we were doing
Hmm.
at church.
Hmm.
Um but then I discovered she and I have a shared passion,
Hmm.
and that is crochet.
That's correct.
And so then we started to talk about crochet, and
Hmm.
she'd give me tips and things like that, and I give her tips, and that's our shared passion.
Hmm.
And so Miss Gwen has a small business, Sugar Baby
That's
Crochet,
correct.
and she makes some fabulous items. And I want you to talk to us just a little bit about Sugar Baby Crochet, Miss Gwen.
Sugar Baby Crochet came from me being in a point in my life to where I was having, oh my God, just pain outside of this world to me. And I wasn't able to go and do as much as I had been doing, and at home and contemplate, just wondering, why is this happening? Why can't I move without pain? And I prayed and I asked God, give me something to do with my hands. And I was on YouTube and happened to see a lady crocheting,
Mhm,
and I'm like, she what? It was beautiful to me,
mhm.
and I wanted to learn more, and I asked a lady that I worked with at the time, could she teach me? And she said, oh, when I get a chance. I'm like, okay, the devil is a lie. By the time you came back that next week, I had gotten me a couple of skeins of yarn and had followed a video, and what I did was atrocious now looking back on it, but it was my attempt to teach myself, and I taught myself by way of
Okay.
YouTube videos.
Okay.
And so I've been crocheting since 2010,
Okay.
and did some things back then, 2010, 13, 14. Then I had my hip replacements, and being able to move about better at that point in time, I put the hooks down. And probably about 6 months ago, 8 months ago, maybe, I heard God pick them up again, and I did just that. And God has been good to me. I'm thankful for all my customers, for the people that even inquire. I'm thankful for it. I enjoy doing it because it's peaceful, it's calming. I'm not just doing it to sell something. I'm doing it because I'm giving you a piece of me. I'm giving you my
Okay.
time. I'm giving you, um, yeah, I just
Yeah.
love it. I
Yeah. Yes,
absolutely
love.
love it. And
So,
thankful for the
so do you
ability to
have
do it.
anything you can show us? Because you just made some beautiful stuff. And then while you're looking for stuff, I have a question that somebody did have, and I haven't given my audience opportunity to ask questions, and I generally do that.
Hmm.
We have one. What type of foods do you eat for breakfast?
For breakfast, okay, so for breakfast, it just depends. Y'all, I'm right now, I'm not on any specific diet per se. I do a lot of intermittent fasting. So sometimes I'm not eating breakfast, just depending on the day, okay? Or
Okay.
I'll have boiled eggs, but there's some mornings when I've got some, two pieces of sausage, some grits, two pieces of toast. I'm just gonna keep it real with you. But right now I'm not doing anything specifically, and there are times when I'll make the smoothies. I have a juicer. I juice sometimes. It just depends. But right now I'm not doing anything specific. The thing that I do more often than not is the intermittent fasting. Okay.
Okay. So I've heard a lot about intermittent fasting. Is that something that is healthy?
It
Is it
is. It is,
okay?
but and you build yourself up to it. It means that you have a window of time that you eat, and you make your decision as to when that is. I started off. Um, I would cut off eating probably about 7 or 8 at night, and not eat again until 12 o'clock noon.
Okay.
Right. So if
Okay.
you add those hours up, and then I said, okay, I'm not hungry. This was after a while of doing that. Can I go to 2 o'clock p.m.?
Hmm. Okay.
Okay. And I would do that. All right. So from 2 p.m. to 8, I had a 6 hour window that I could eat. And I would
Okay.
eat during that window of time. Right. And
Hmm.
so once I'm done, that's it until the next day. I'm trying my best to get back to 2 o'clock. Right.
Okay.
And so
Okay.
what it does is intermittent fasting, at the time that you're fasting, that gives your body time to repair itself cellularly. Okay?
Oh, okay.
Yeah.
Okay.
So it helps
Okay.
with the diabetes. And I've noticed, when I went and saw Dr. Patel, Hiram Patel is my primary care physician. Wow, you've lost this weight. Wow, your cholesterol, because of the intermittent fasting.
Intermittent fasting.
Mm-hmm.
Okay. Well, I'm gonna have to try that. I was doing it.
Mm-hmm.
My problem is discipline,
Mm-hmm.
Gwen. And so we're gonna all everybody who on this live, we're gonna pray for Julia's
Mm-hmm.
discipline. Because that's truly my problem when it comes to exercise and when it comes to eating and stuff like that.
So
So
let's look
I'm
at
gonna
this.
go
Not
back.
to cut you off, but look at this, y'all. And I want you to pay attention to this. Julia and Gwen, we both have hypertension. We both are type 2 diabetics. We both have different body types.
Mm-hmm. Mm-hmm. Mm-hmm.
Now, you more people would guess that I have hypertension and diabetes than you,
Mm-hmm.
because of your body type.
But I have it. I
So
have
you
it. And
can't judge a book by its cover. I have,
mm-hmm.
but and also now let's talk about it. We, you can listen. No matter what color you are, you can look at people and think, "Oh, that person's small," or that person. You can think, "Well, the bigger person has more issues," and you would be surprised. Not every
Mm-hmm.
large person has high blood pressure.
Right.
Not
Right.
every large person has diabetes.
Mm.
Not every skinny person. is healthy.
Right.
Okay, because genetically they may be more
You
predisposed to
disposed
certain
to.
things.
Mhm.
So this is
Yes.
why you go to the doctor and find out what your numbers are, and find out, and if he feels like you need to see a cardiovascular physician, a heart doctor, then he will then refer you to one that will do a heart catheterization or a stress
Mhm.
test, okay?
Mhm.
That you're needing an echocardiogram, all right? To go further into and see where you stand when it comes down to that. Just showing you that the two different body types, and we have the same thing.
We have the same thing. Yeah. So you can't judge a book, ever judge a book by looking at the
You can't.
cover.
You can't
Okay.
tell by
So,
age or anything.
mm-mm. So show me, Gwen. You were going to show me some.
Baby, I don't. Let me tell you something. I have some hats and they are in a box. The ones that
Oh, okay.
if I work on a new pattern, let's say I want to try it out first. I have a
Okay.
box that I'll put those, but my pieces are made to order.
Okay.
Okay, and since I started back crocheting and posting online, I've not been able to just build up a stockpile
Inventory.
of beanies or
Mm-hmm.
anything.
Mm-hmm.
Hopefully
Mm-hmm.
that's going to happen.
Mm-hmm.
Hopefully I'll find more time to do that because I have people that I want to sew into, and in between stuff I'll do something, and who here's my gift to you. But
Mm-hmm.
here lately that's been very hard to
You
do.
be okay.
So when I put up a picture, 9 times out of 10, that's a
That's
customer's
something that's
order.
already
So
so.
unfortunately, I don't have anything to
But
show tonight.
they
But I
can see
bagged up some
your
stuff.
stuff on your Facebook page.
They can see stuff on my personal Facebook page, and usually I tag Sugar Baby Crochet in that, and then you can go to my page as well. And coming soon, I'll have another way that you can see that information as
Okay.
well. But right
Okay.
now, and if you're interested in anything, inbox me and we'll talk and we'll get together about that.
Thank you so
Thank you for
much, Gwen.
having
Thank
me.
you, thank you, thank you. And I'm
You
going
are
to be
doing an
reaching.
awesome job. You're doing an awesome job with your Sunday evening talks. Continue to do this. This is so needed in the community. And if we don't inform ourselves, you're gonna always be behind. Get knowledge. Knowledge will save your life. You
Yeah,
hear me?
knowledge is power.
It's
Knowledge
very
is
much
power.
so. Thank you
Thank
so much for having
you,
me.
Gwen. I appreciate it. And I'm going to reach out to you because we're going to do some stuff together, okay?
Absolutely. I'm
All
here if you
righty.
need me. All
Bye-bye.
righty. Bye bye.
All righty then. So we just want to I just want to thank Miss Gwen so much. And so now I'm going to invite one of my friends, another one of my friends to come on and uh, Mr. Jackson. And Mr.
Yes,
Jackson
yes.
uh, suffers from heart disease, and he had a very life he's a miracle, really. He is a miracle, a living testimony because he should not be here. And it was all because of heart disease that went untreated. And so, Mr. Jackson, if you would just give us a bit of your story. First of all, what I want to know is what kind of symptoms did you have?
Well, wonderful. Thank you. Um, I kept having this flutter in my chest, and people kept telling me to get me a taste of mustard. And I'll never forget, I was in Illinois working, and I don't know what happened, but I could not breathe, or it was fluttering, and so I was in Walmart, and I had to call 911. And so I
Mm,
went, it took me to the emergency room, and that's when they diagnosed with me with asthma. They gave me an inhaler and said I needed to do an inhaler. And so I
mm,
was doing an inhaler for I'll never forget. This was probably in June. Well, in September of that same year, I was so sick that I couldn't walk 3 feet without being out of breath. So my first stint of heart health, heart disease, came when I was in Opelika at East Alabama Medical Center. Um, I was diagnosed with congestive heart failure. But the doctor told me that I had been probably walking around with high blood pressure for many years. And it just started to act out. I was very active. I was doing band, college cheerleading, just did a whole bunch of stuff and was still walking around. And even all the physicals that I had, because in order to be a part of those activities, you had to go get a physical. I never was diagnosed with high blood pressure. Well, during that year that I was diagnosed in Opelika, I stayed in the hospital about 2.5 weeks, and I was diagnosed with congestive heart failure. So at that time, I had a really good physician that brought me back to health. And at that time, I was told I had afibrillation, which is a irregular heartbeat. And so they uh, went to have a procedure to take me out of AFib, and they got me out of that. And so, uh, moving right along super fast till 2000. Here recently, I had a flare back up in 2019, and it was very bad.
Yes.
Very bad. I'll never forget. I was with my sisters, the Thomas sisters, and Joy said something to me, and I thought she was being angry or showing me anger. I said, "Are you showing me angry?" She said, "No, she was concerned about my breathing." And this was right around the time, and at that time, I was probably sick as a dog, but this was probably in October. And I walked around from October all the way to December 26th. And that's when I had a 2.5 month stay in the hospital. I was on the brink of death. I was on life support. I was intubated for 19 days. And for those of you that don't know what intubation means, that's life support. And the maximum number of days that you can be on life support is 13 without them putting a trach in you. I didn't know where I was. It was just a really bad situation. But I want to shout out to Emory University Hospital. I had some phenomenal medicinal professionals. I mean, phenomenal. I've never been in a situation where your whole healthcare team will come in the room every morning at 5:30 and address your issues and tell your family what is going on and what they're going to do. And they were so involved in my care, and I didn't even know, but my sister, and I want to really thank God for her, and all of my family members that really stood closely by me, because I'm going to tell you something. Gwen made a very important point that we need to know our numbers. And I am a huge proponent of that. I'm an advocate, because what I love about my health professionals is I have a portal. Whenever I want to see what my numbers are, I log into my portal. I can see the whole print out of all of that stuff that Gwen was talking to us about, the LDL, the HDL, your hemoglobin, your A1C, all of this stuff. And what I love about my portal is it's color coded. So it's just like the traffic signal. If something is in red, you know you're in danger. If it's green, you're good. If it's yellow, you're at the border. So thank God I'm not a diabetic, but my profile would make me be prone to diabetes because I'm obese. I'm on a blood thinner. I have high blood pressure, hypertension, and I am considered to be a proponent of kidney disease if you continue to have blood pressure and all these other things, but I'm not advanced kidney disease. So I
Okay.
don't claim that, but um, I really went through the ringer. I stopped taking my meds. Go ahead,
Mhm.
Julia. I know you have
Yeah,
some
because
questions.
I wanted to ask you more about your
Sure,
symptoms,
sure.
and I know at that time everybody was telling you, Jerry, something is not right, and you
Right.
were ignoring the symptoms, or you weren't. I
Was
mean,
I
what
was being
what?
just I was being just a typical black man, thinking that, oh, this will get better. You know, in
Mm-hmm,
my ear, the devil kept telling me, oh, you'll be all right, you'll be fine. But
mm-hmm,
it was getting
mm-hmm,
worse and worse. I could
mm-hmm,
not breathe.
mm-hmm.
My ankles, Julia, they took off 100 pounds of fluid.
Uh-huh.
My ankles were huge.
Okay.
And
And
that's a
then,
symptom.
Jared, I'm thinking, didn't you tell me you had so much carbon monoxide
Exactly.
in your
I had
blood?
my yes, I did, and my oxygen level was 66%. If
Mm-hmm.
it goes down below 92%, you're in danger. I was a
Mm-hmm.
walking time bomb.
Mm-hmm.
The doctor still says he doesn't know why I did not have a stroke. I did not have a heart attack. Why my organs were not damaged, because I walked around for quite a while in dire straits. I mean, Julia, I would go to bed and fall out of the bed.
Mm-hmm.
I don't know. I don't know what that was. And my brother Mike, he heard something, and that was the time that I had driven home to
Mm-hmm.
be at mother's house, and I went. I was so exhausted I couldn't even get the luggage out the car to walk up the steps to get in the house. All I wanted to do was lie down. I went to sleep, fell out the bed. I did that 2 or 3 times,
Mm-hmm.
and then that day, the next day was Christmas, so I went down to my sister, my brother-in-law's house, and all I wanted to do was sleep. I went in there and went to sleep. And my brother-in-law's niece was a nurse practitioner. She wanted to check my oxygen and all of that. Well, I wouldn't let her do it, but when I was asleep, they did it.
Uh-huh.
So she told me I needed to go to the doctor, to the hospital. I said, I'm not going to anybody's doctor around here. I want to go to Emory. So that next morning, I woke up and I told my sister, I said, come and take me to the hospital. She drove me to the hospital on the 26th of December, and I did not get out of the hospital until February.
It,
Julia, my
it was
symptoms,
it was a struggle, Jerry. We were
yes,
all praying hard for you because we were all just so worried about you and about your condition. And that just reiterates what Gwen was telling us. See your
right.
doctors.
And Julia,
Know your numbers.
right, and Julia, let me tell you something. The swelling of your ankles, and my ankles were swollen. It was so big. I mean, everything. My stomach was hard as a brick, and my genitalia had gone up into my stomach. And
Mm.
it was, I didn't know what was going on. But that's a sign of congestive heart
Congestive
failure. And
heart failure.
and see,
Mhm.
one of the big things about congestive heart failure is you have to have a very strict diet,
Mhm.
and you're placed on some very expensive meds, which is another
Mhm.
thing that's a whole nother topic of a
Yeah.
conversation.
Mhm.
Because um, Eliquis is a blood thinner, and it costs almost $400.
Mhm.
However, there's
Yeah.
some support out there to get that. But Julia, my symptoms was the hardening of the stomach, the the ankles were swollen, my neck, everything was really bad off. But I ignored that because I didn't think that I would be, didn't know. And then you also the coughing and the
Mhm.
coughing up the flame.
Mhm.
That's another thing.
Okay.
And the doctor told me that the fluid was just taking over my lungs because the fluid was building up, and they
Mhm.
took off 100 pounds of fluid
Okay.
um, in those 2.5 months that I was there.
Well, Mr. Jackson, thank you for being willing to share your story. We appreciate that because so many people don't want to share their story. And I am so glad that everybody joined me tonight. I wish we had longer to talk about this, but we're going to do some more things around health because that is so important. And we have to take better care of ourselves. We have to, like Gwen said, we got to get us a primary physician. Remember, she said urgent care and the emergency room are not replacements for a primary physician. We need to know our numbers. We need to at least have our exams annually. And then she said, make sure you take care of your teeth because your teeth can lead to heart disease and other strokes and things of that nature. So we're going to have um, some more medical. I'll make sure that we have some more. We talk about some more medical things and things that affect us in the Black community. And like Jerry said, the cost of prescription medicines, but what can we do to reduce those costs? What things are out there? What things are available? Thank you guys for joining me here
Julia,
on
may I?
Let's Talk. I'm gonna let you
Okay,
come in, Jerry. Just one
sure.
second. Because I do want to let my audience know that we won't be here next Sunday. Next Sunday is the Super Bowl, and so we'll all be watching Usher and whoever playing. I don't know who playing, but I know Usher will be doing halftime. So we'll all be watching that next week. But then the following week, we're going to talk about love. We're going to talk about love in the Black community. What is love? Okay. And then on the fourth Sunday of this month, we will be doing Black history. We'll have Black history trivia, and you'll have chances to win prizes. Real quick, Mr. Jackson, before we leave, what did you have to say?
Well, there was a question in the
Oh,
chat
okay.
that was asking, isn't a sign of congestive heart failure where your ankles are swelling? That's just a sign of heart issues, period.
Mm-hmm.
Um, when your ankles are swelling, we a lot of times women, they'll say, "Oh, my ankles are swollen," or this and that, and I need to do this. Well, when you have a high sodium intake, that's going to cause a lot of the swelling. Excuse me for playing around with this camera, but that controls your sodium intake is so important. And most of the doctors will treat the high intake with the sodium with some type of a Lasix. Um, and and
Mm-hmm.
you have to be careful with that too, because
Mm-hmm.
that will
Mm-hmm.
push out.
Dehydration.
It'll mess with
Mm-hmm.
your
Your
potassium, magnesium. It'll
kidneys.
just mess with a
Mm-hmm.
lot of stuff. But
Mm-hmm.
Julia, thank you so much
You
for
us. You are
allowing
so
us to
welcome, you
come
guys.
in.
I love you all. Thank you so much. I thank you for you all for tuning in, and I see based on the number of viewers that we had today that this health issue is something that is
Yes.
interesting to that people are concerned about. So we will do more discussion on health. But thank you guys for joining me. I am Juju, that mountain moving giant slayer. And my motto is I am walking by faith, inspiring hope, and sharing love all along the way. And until I meet you, not next Sunday, because next Sunday we're all for the Super Bowl, but until I meet you again, I wish you much love and many blessings. You guys have a good night. Love you.